It was the scariest day of my life. I'll never forget it. She was kind of lifeless by then. She was hooked up to everything. She had tubes placed in her ears. They referred us to hematology because of all the bleeding. She bled for weeks from her ears after that. It was terrifying because I didn't know what was going on. I thought maybe she had cancer. I remember being at work and Josh called me and he said they just called with Kinzie's results and they said she has von Willebrand's type 3.
Blood is made up of various proteins and one of them is called von Willebrand factor. And her blood is missing that.
Von Willebrand's type 3 is very, very rare.
Not a lot of girls out there that have it, just based on that hemophilia is primarily boys. And von Willebrand's can go either way, but it's just very rare to have the type 3. As she gets older and matures into puberty, there will be more issues there being a female. Heather and I both carry the gene and pass it on, so there was a percentage chance that we would have a child with type 3 von Willebrand's like Kinzie. Her older sister Jayla has type 1. Brother Milo now has type 1 as well. Kinzie requires a lot more attention with the medical issues, but if it weren't for Kinzie, we would have never known about Jayla.
Kinzie has a few really rough episodes where she would have lots and lots of bleeding. One episode, she bled all day and I was home with her and the nurses came and the nose doesn't bleed any faster than normal, but it just bleeds for a long time. She just can't form a good clot with von Willebrand's. So we ended up at night, she was kind of getting lethargic. She was just extremely kind of getting out of it, and she's a really active kid, so I could tell something was going on. So at that time we were actually living further away, so it took us like almost 2 hours to get to the U of I.
She had lost so much blood that day, and it was just, her veins have always been just very poor. The next day we were admitted and we stayed for a few days. I think the next morning we talked with her team and they talked about finding some other way for access besides the venous access. And we kind of decided to go with a port from there. So it's been a lifesaver for us. It's been a great thing for us.
Every year we would have a little birthday party for the port and have a cake or ice cream or something. So that was something kind of fun we did. The University of Iowa Hospital puts on the hemophilia camp every year and both my girls get to go. Her doctors are there, her nurses that she's familiar with and we've known for a long time are there. And they're great with the kids. I believe one of the doctors last year let Kinzie poke her last year. So that was a pretty big deal and Kinzie gets a little stick award for poking her doctor last year, so this year she got a big stick award for poking herself.
Kinzie was so proud because she had stuck herself 2 days before we went to camp for the first time in her veins, so that was a huge milestone in our life. She had pictures and video that were on my phone to show them when we got there, and she was just grinning from ear to ear. So she knew they'd be proud of her, and they were.
Kinzie has annual visits at the treatment center here at the University of Iowa. They really focus on Kinzie and how she's doing, and they talk to her, not only us as parents, but Kinzie as the patient.
If Kinzie's nurses, doctors, and the whole care team were here, I would just want to tell them thank you. You really changed our life. We didn't know how we'd be able to handle this, but you've given us our lives and Kinzie's life.
Through all of this, Kinzie has taught me to be strong. She is an amazing little girl. She's so strong, stronger than I could ever be.
Sometimes I feel like she teaches us more than we teach her. When they told us that the odds of having type 3 von Willebrand's was about 1 in a million, we thought that's about right. That's Kinzie. We always felt she was 1 in a million.